Okay, good morning. My name is Eric Yen. I'm the Director of Marketing for Shield Healthcare. Thank you for attending our webinar titled Quality of Patient Care Star Ratings, How to Improve Your Star Ratings, 2018 and 2019. Listeners will be in a listen-only mode. If you have a question, please type it on the question box to the right hand of your screen. There are also handouts that illustrate how you can get CEs after the presentation. I'd like to introduce Lance Tortolano, who is our presenter today. Lance is the president of Tortolano & Company. He graduated from Merrimack College and became an auditor and tax specialist with a large regional CPA firm. Following his departure from public accounting, he became the controller for a Northeastern healthcare group who provided home health and rehabilitation services. After seeing a need for services that went beyond a typical accounting or consulting firm role, Lance founded Tortolano & Company. Tortolano & Company bridges the large gap between financial aspects of a healthcare organization and the operational aspects, providing a cohesive solution promoting quality patient care and financial prosperity. At this time, I'd like to present our presenter today, Lance Tortolano.
Good afternoon and good morning, everyone. Today we're going to talk about the quality of patient care star ratings, also commonly known as just the Home Health Compare Star Ratings. The objective of this presentation is to discuss the star ratings, understand the data and how it's measured by CMS, and also provide some guidance and information on the updates and changes that have occurred in the past 3 years since the program was initially released. We're also going to discuss how your agency's rating is calculated and how the effects affect your agency essentially going forward. The purpose of the star ratings was based on the Affordable Care Act. The purpose was to promote transparency, increased education and public awareness, quality reporting, and it's to divide the gap between providers and patients and their families, essentially, who use the information to make a choice on who's going to provide the care. The star ratings are also used by other providers, from hospitals all the way to Medicare Advantage plans. So let's get going and let's start discussing. Transparency is a big component of the star ratings. Transparency and the star ratings was the main component to help patients understand what's going on with the provider and how well the provider treats a patient. Basically, it's to understand how well the care is and how often the patients get seen, how often the patients get better, essentially, and how the care is provided. The star ratings were developed to take the clinical components that are sometimes difficult to understand and simplify them into a hotel-similar rating scale of 1 to 5. Obviously, a 5 is going to be the top-rated provider, and 1 is going to be considered the lowest provider. When you think about the ratings, you have to compare it to basically a hotel. Where would you rather stay? Would you rather stay at a 1-star hotel or a 5-star hotel? For patients, when they look at these ratings, they're going to want to be at the 4 or 5-star providers. And they're going to want to get the care from the providers that have that type of rating. But in healthcare, taking the information that makes up those ratings can be difficult. And this is where the Home Health Compare website bridges the gap, and these ratings come into play. The star ratings provide transparency between providers and patients. This allows patients to understand how well a home health agency and other providers such as hospitals, hospices, and doctors treat patients. The ratings can be used to compare your agency and other agencies within a specific service area. Sometimes these ratings, though, can have a negative effect and can almost act as a public shaming for some agencies because of the type of care that's provided or the population that they serve. Medicare has been working up to this for the past few years, even before the star ratings were released, and basically creating a pay-for-play scheme where your agency has to perform or the public is going to find out that you're not doing as well. In some cases, if you're not submitting Oasis data, for instance, your reimbursement rate is going to get cut. In home health, this can be very, very disastrous since the profit margins for agencies are very limited right now. For smaller agencies, the profit margin can be anywhere between 0 and 1 or 2%. So any type of reimbursement cuts that are affecting the agency can be disastrous. I'm going to go into detail more on that. Agency ratings are derived from two sources. The CAP survey is data that is collected from an agency's vendor and the information that an agency provides to that vendor. That vendor then goes out and takes the patient list, the contact information, and calls the patients or mails a survey. CAP surveys are the responsibility of the agency. Agencies are supposed to contract with a specific vendor and to make the initial choice on who they're going to use and commit to that surveyor company for at least a year. When you select a vendor for that survey, for the CAP surveys, you need to make sure that the system is in place, that you can obtain data easily, you can pull information, and it's affordable for your agency. Larger agencies get a much bigger discount, whereas smaller agencies fit all into one category in one price element. So it may not always be too affordable, or it may seem expensive for smaller agencies, but it is a requirement. For most agencies, Oasis data reporting is common. It's just part of the normal process. It happens every week, every few days. However, there are still some agencies that do not report Oasis data. It's becoming more and more rare. But if your population of your agency, if your census is mainly comprised of Medicaid patients, for instance, or patients that have private insurance, you may not be reporting your Oasis data. Most states do require that Oasis data gets reported. So for agencies, this is commonplace. However, there's a big caveat. Just because you're reporting your Oasis data doesn't always mean that it's going to be taken into effect for the star ratings. The star ratings are based purely on Medicare data. So if you don't have any Medicare patients, you're not going to have a star rating. We'll talk more about that in a few minutes. Like I said, home health agencies are not the only providers that use the star rating. Nursing homes, physicians, dialysis facilities, hospitals, even Medicare Advantage plans, and last year hospices were all added to the Compare website group. Nursing home measures have their measures pulled from admissions and discharges. Physicians are based on patient satisfaction, similar to your home health agency CAP survey. Hospitals are the group that faces the most scrutiny because their ratings are directly tied to their reimbursement. And that reimbursement can be penalized based on how well they perform. Now, for a home health agency, a hospital is going to look at your star ratings. For hospital discharges and a home health agency, those are typically the most lucrative referrals that you can get just because of the type of services that you need to provide to a patient when they leave a home health agency. A hospital, and go on to your home health agency. If a hospital sees that your star ratings are lower than the competitors and your peers, they're more likely to try to avoid referring to you or use your agency as an agency of last resort. Therefore, an incentive for agencies to do well is to make sure that your ratings and your quality programs are in place to create that level that you're providing patient care at a 4 or 5 star level. For some agencies, this can be really difficult just because of budgetary concerns or because of a limited staff. But agencies need to continue to work towards that ability to provide 4 and 5 star quality care and be able to show that through documentation. Documenting that change in condition from the beginning of the episode to the end of that episode is going to be where your 4 and 5 star ratings come into play. And we'll talk more about that in detail. The star data is broken up into 2 components based on 8 data points. There are 2 process measures which are based on administrative information, and there are 6 outcome measures which are based on clinical agency data that gets collected from admission and discharge Oasis. The information that you see on Home Health Compare is reported in quarterly rolling periods. And that quarterly data gets updated once a quarter, but it's usually about a year behind. The 2 process measures are based on the timely initiation of care and drug education on medication that's provided to patients and caregivers. There was a prior measure on this that was related to the flu vaccine, but that was removed from the calculation in April of this year. CMS removed that data because 90% of home health agencies had answered that question that your agency checked to make sure that the patient had a flu vaccine for the current flu season. So for CMS, when they're trying to evaluate the data, that measure was so strong that it skewed the other information and basically was helping agencies that may not have performed so well get bumped up. So CMS wanted to take out that factor in the calculations. The current 2 measures, the timely initiation of care, is basically related to how fast you start care of the patient and you admit that patient. And drug education is whether or not your staff are educating the patient and documenting that correctly in the Oasis. The next set of outcome measures are going to be based on clinical measures. And those 6 are the improvement in ambulation, bed transferring, bathing, pain interfering with activity, shortness of breath, dysphagia, and acute care hospitalization rate. For hospitals, where your major referral sources should try to come from, which are going to be the most lucrative under the new reimbursement model if it gets implemented in 2020, this is where you're going to have to really pay attention. The hospitalization rate is going to be critical. Hospitals want to see that your hospitalization rate is low. So if your hospitalization rate is higher and a lot of your patients get transferred to the hospital under your care, this isn't going to look so good. It's not going to look good for Home Health Compare. It's also not going to look as good for your referral sources. Nursing homes are also going to potentially get tied into this as well, and they're also looking at this hospitalization rate because that can come back to them if you have referral sources from nursing homes and SNFs. Star data and measures. So to qualify for the star data and to have your information show up on Home Health Compare without it being blank is critical to understanding that you need at least 20 episodes of care that are completed per reporting period. This means that your agency must maintain 20 complete episodes for at least 5 of the 8 component measures for a 12-month reporting period to have your information released. For some agencies, as we discussed earlier, this is going to be very difficult. If the majority of your population is based on Medicaid, you're not going to have any Medicare data to report. So your ratings are going to show up as blank, as insufficient data. If you're providing mainly care to Medicare Advantage or to private insurance patients, again, you're not going to have any Medicare data to report. So your profile and your report online is going to be empty, essentially. For agencies that are looking to partner with other provider sources and to develop that quality rating that you probably are providing, you just can't show publicly, it's important that you either start to shift your referral sources to become more aligned and get more Medicare referrals, or you have internal data that can support your own benchmarking. The current data was just updated over the summer, and we're going to get into that in a second. The last update was July 25th over the summer, and that was for the period ending October 31st, 2017 for HCAP data. The Oasis data was for the period ending July 31st, 2017. Now, this data is old, so if you were to start making a change in your quality and working towards becoming a 4 or 5 star rated agency now, if you aren't already there, it's going to take at least a year for that to show up in the reported figures and the reported star measures. Because it's an updated rolling 12-month schedule and updated each quarter, it does take a significant amount of time, which can be good or bad. So if you're doing well already, but and your quality starts to slip, it's not going to show up immediately. A lot of times what happens is agencies try to maintain that quality level constantly, but sometimes it's not always possible. And by the time you find out, it could be too late. So 1 month you could have a great quarter and you could be at 4 stars for that period, but the next quarter, when the data is released, you could be at 3.5. The increments in half-star measures don't change too dramatically if there's an issue, but it doesn't always take a big swing depending on how big your agency is. The next update is scheduled for October in the coming weeks, and that's going to be for the fourth quarter of 2017 for CAPS data and the third quarter of 2017 for Oasis data. Agencies that are paying attention should be logging into their CASPER system, the QIES and CASPER system, and pulling the preview reports. The preview reports are usually released 2 to 3 weeks before the public data is released. These reports are very critical to understanding where your star rating comes from. It's going to do a few things. It's going to report exactly what the Home Health Compare website shows in your star rating, but it's also going to show you a benchmark of your agency versus the other agencies in your area for the state, but also the national benchmarks. Your quality staff should be running these reports, getting these preview reports and discussing them with management so that you know and you can be prepared for any decreases. Obviously, if it's an increase, you want to prepare for that as well, because that's going to be good news, and you want to share that with your referral sources and your various partners that you work with throughout the community. A decrease, you want to be prepared for as well, and you want to make sure that you can explain that to whether either your hospital referral sources, your SNF referral sources, or your other community partners, just so you can get ahead of the story, basically, and it doesn't blindside you. The ratings are calculated based on a complex statistical model and algorithm based on data from your agency that's submitted through the Oasis, but is also submitted through the CAPS information and is fed from the national database of Oasis information that is submitted from all across the country. The algorithm used by CMS breaks data into smaller calculations and averages the data together to form the star rating. Together, this information is combined and adjusted for statistical issues and then published in CASPER with the preview reports and then on the Home Health Compare website. One thing that agencies need to be aware of is that they can challenge that information. They can challenge the data. Your agency, as long as it's downloading the preview reports, has a window to challenge that information that's going to be shared with the public if there's an issue. If you don't believe your agency is a 3.5 star rating and should be a 4, when you download that CASPER preview report, there's actually an email address included that you can contact CMS and you can open up a case which will start the appeal process and the investigation process. When CMS does that, they go in and they look at your data. They make sure that the calculation's correct and all the parameters that were used to determine your star rating are actually valid. Agencies that do this sometimes don't get anywhere, but sometimes they do get a change. It's worth it if you believe your star rating should be higher based on the quality metrics that you have internally from your own CAPS data, your own Oasis data, your own benchmarking, and your own analysis. Overall, the ratings that are released to the public that compromise the star ratings are based on averages. Taking into effect agencies across the country, the groupings of data that's used gets weighed and then turned into the average that your data gets weighed against and then put together, and the star rating is developed. When CMS released this based on the 1 to 5 star rating, the rationale was that it was to make it as easy as possible for agencies to understand, but more importantly, families and patients. Education on these ratings is very, very critical, not only for your agency, but for also the patients and the families that are going to use this information. If a family looks up your star rating and you've admitted their parents, for instance, and you're only at a 3-star rating, they may ask you why you're at that level, or they may compare you to another agency in the same area that's a 4 or 5. You have to be prepared to explain this, just because as families become more technology savvy and patients themselves become more technologically advanced, this information is getting out there. We are starting to see that patients are becoming much more aware of their settings and who's providing their treatment. So Medicare believes that using this 5-star rating, whether it's good or bad, and it's whether it's a clean or a clear determination of how well your agency performs, is sticking to it. They've rolled it out to every other provider, as we talked about. So the most recent information, the average score for 2018 for an agency is 3 to 3.5 stars. That's basically your average. In 2015, when CMS originally rolled out the star data, the rating stayed the same, 3 to 3.5 stars. So in 3 years since that initial development and that initial rollout, not much has changed. Almost 77% of all agencies across the country submit Oasis data. And as I discussed earlier, that 77% is based on patients or agencies that provide Medicare services. There are other agencies that I said don't provide any type of Medicare services that don't have data present and available for CMS to calculate. So this is basically how the ratings, and most agencies know this now, about how the ratings are grouped. So 3 stars in your statistical average is 2.5. CMS was basically generous and started the scale at 0.5 rather than 0 or below, and gave everyone a 1 star from that point forward. Most agencies, as we discussed, are 3 to 3.5 stars. Whether that's good or bad, in terms of the industry as a whole, that's something that's another discussion. But for your purpose, you want to make sure that you break out of that average grade, basically, and go up to the better, which is 4, 4.5, or 5. There are very few agencies that are at 5 stars. However, there are getting there a lot of agencies that are moving to that 4 and 4.5 level. The agencies that are at that 4 or 4.5 star level are typically the agencies that do have a strong quality department. They're consistently educating. They're very, very detailed, and they're very aware of how the data works. Remember, this is just this is a data game. And for CMS, All they're looking at is data. They're not looking at other influences and factors that basically affect your agency. The effects on your agency. Obviously, with the Home Health Compare website, updates on a rolling schedule, and different positive and negative effects, you have to know how to deal with it. Home Health Compare itself is not the easiest website to use. It can be a little frustrating even for savvy web surfers. It can be overwhelming with the amount of data that's there. Even though CMS has tried to break it down from a clinical perspective and a data perspective into layman's terms, the information can still be overwhelming. Patients, family members, they all go on and they all look at the different information, but whether or not they comprehend what that means is another story. And that's where your agency comes into play. Whether you're a 4.5, 5-star rated agency or you're a 3-star rated agency, you need to be able to explain what that means. You may have a couple 4 or 5-star rated agencies and you're one of them, but you have competitors in the same area. You still have to be able to distinguish yourself and make sure that your patients and your referral sources know why your agency is as good as it is. These star ratings don't necessarily promote a good or bad agency. It just means that the agency knows how to complete an Oasis and knows the data points that are being used. The improvements that you make throughout the year, for instance, if you set a goal that you're at 3.5 in January, and by the end of the year you plan on being at 4 or 4.5, you should be able to show that progress internally from benchmarks and show what you've done. It's not going to be quick. It's going to take a whole nother year after you make those changes to show up. And you have to be patient, not only internally as you work through it, but externally as the data becomes available. We've seen a lot of agencies that do try very hard at becoming a better agency on paper, and they do make gains, and they go from 3.5 to 4 and 4 to 4.5. But it's not immediate. It's not real time. Internally it is, because you have control over that. But externally, the information is lagging. It's a year behind. Therefore, when you're doing these performance improvement projects, you need to make sure you have your own set of statistics and benchmarks and use that to help market, to help show that your agency is committed to quality and you are getting towards those higher star ratings, and be able to show that to referral sources. Staff education is a big component of this. Your admission nurses, your case managers, your RNs, your therapists, if you have therapists do your admissions, they all need to be aware of how to score the Oasis and how to make sure that the information that they're presenting about that patient is really realistic as compared to the question that's being answered. For instance, if one of the measures has wording where they think that common sense value might fit, they need to really look at their guidance, and they need to talk to the QA reviewers and the staff in the office who are very well experienced at reviewing Oasis to get the proper determination. There shouldn't be any type of guessing, essentially, on a Oasis, because all of these factors are going to eventually come back to your star rating, especially the measures that are being measured and calculated. You need to make sure that staff are constantly educated, they're constantly trained, they're constantly made aware. It should be an agency-wide goal to get from whatever star rating you're at now to the next level. So jumping back onto star education and staff education, it's important to make sure that staff understand that the stars are just one component. In 2020, your reimbursement is going to be potentially affected by how well you complete the Oasis and how well you paint a picture of that patient when they come into your care. In 2020, when the PDGM model, if it gets released, which we think it is, and they're leaning towards it, if that goes through, you're not going to have therapy as a buffer zone for reimbursement. You're going to have to really analyze that patient. And that information is also going to get tied into your star rating. So if you start today, if you start next week, going forward, making sure that your star ratings are moving up, it's all going to help you in the future, not only from a publicity standpoint and a public rating, but it's also going to potentially help you with better reimbursement in 2020. One area that we see not always lacking, but not always given the proper attention and the proper accolades is the quality department. Your quality department really has a handle on whether your agency is making money, whether your agency is doing well, and how well your agency is going to represent itself to the public. Your quality assurance staff really are kind of the unsung heroes of a home health agency, because they're the ones that are supposed to be educating the staff. They're the ones that are trending all the data. They're the ones getting deep into the Oasis. They're the ones that are seeing the staff issues who aren't necessarily picking up on certain aspects of their documentation. We always like to advocate for the QA department and make sure that QA has the proper staffing levels and the proper training. They're up to date on coding, that they're really the revenue driver of an agency. They can make or break your agency. So while they sometimes don't get the due that they deserve, they should. They're also the ones that are going to be pulling the CAPS reports and making sure that the CAPS data is correct, that the patients are being called, they're being mailed the surveys, that they're coming back. They're the ones that are going to compare that data to what's on the Oasis and their internal benchmarks and the other reports. If you have other outside companies that provide benchmarking data, you want to make sure that your quality assurance department is taking that into effect, pulling that all together and providing that to management, but also your staff. Your quality assurance department is going to be the ones that work with your staff educator. If you don't have a staff educator, or if your agency is not big enough to have a dedicated staff educator position available, it is recommended that you have one of your nursing managers, your director of clinical services, or one of your QA people actually do that and have a dedicated amount of time per week to sit with staff, educate them, go over the problems, answer questions, and really dig into those Oasis questions that not only affect your star rating, but also your potential reimbursement in 2020. CAPS are only effective as your vendor. While it might be worth, saving a few dollars to go with a CAPS vendor that may not always be the most expensive, they can really make or break your star rating. So look at your star and your CAPS vendor. Make sure that your CAPS vendor is making those necessary calls and sending out those surveys timely, but also make sure you're educating staff. As we talked about, Oasis is very important. Oasis review, Oasis education. It all comes down to setting measurable goals. The starter care and the Oasis and the discharge Oasis review is very important. It shouldn't be overlooked. It shouldn't be tried to be glanced over or skipped over. It's very important. And as we get more into a system of patient-based characteristics reimbursement, the level and the quality of your Oasis is going to be more and more important. It shouldn't be something that you just do to get a wrap out the door. Many times what happens is clinicians get quickly oriented, they go over the necessary basics, they get put into the field, and then they get overwhelmed and their Oasis kind of gets pushed to the side. They keep seeing patients, they keep doing visits, or they keep starting new admissions and doing more Oasis, and they quickly get through that. To do a real quality Oasis, it may take a few hours between having the staff sit down and do it and also the QA reviewer go through it. So in some cases, a 4-hour Oasis review might not be unheard of if it's a new clinician. If it's an experienced clinician, the Oasis may be done in 2 hours from start to finish. Either way, it's not necessarily the time, it's the quality of that data in the Oasis that's really important. And it's very important that clinicians understand what the questions are asking, what the measures are trying to validate, and what's going on. When you educate staff, it's not just about inputting data into a form. It's more about teaching that clinician on how to analyze the patient and analyze the information that's available to them and really be present with the patient and observe all of the characteristics of the patient to make sure that that translates into quantifiable data, which eventually turns into your star rating. You want to focus not only on the Oasis measures that affect your star rating in general, but also the Oasis as a whole, because eventually what happens is CMS starts changing the calculation and they start pulling in other data points. So while we have those 8 data measures right now, in a few months, CMS could decide to change the calculation once again and use different data points. So it's good to focus on what they're using now, but it's also good to focus on the Oasis as a whole. And staff education is really important to do that. And you do that through an approach that's agency-wide. The whole agency needs to be focused on quality, not just your QA staff, not just the admission nurses. You want to make sure that you set a schedule and you be able to educate all staff, whether that's the person that answers the phone, or it's the admission nurse, or it's the nurse that does the visits in between the time the patient gets admitted and the patient gets discharged. All of these factors come into play. If there's any interaction of a staff member and a patient, you want to make sure that they're receiving the white glove treatment, because this is all going to be reported on your CAPS surveys, whether verbally, through phone calls, or through the mail when they send out the paper surveys. So it's not just the nursing staff, it's the administrative staff, whoever comes into contact, whether that's your community liaisons who visit the patients in the hospital and bring in a get well card, or if it's a receptionist who answers the phone and needs to direct the patient to their nurse or their therapist. You want to make sure that agency-wide you're focused on quality. Within that agency-wide quality goal, you also want to make sure that you're setting quality goals that are realistic. It's not going to happen overnight. It's going to take time. So if you want to go from 3 stars to 4 stars, you need to be able to set measurable goals and measurable standards so that you can get from 3, 3.5 to 4 in increments. If you try to do it all at once, you're going to basically, it could alienate staff, could drive staff away, it could be hard to recruit staff. You want to make sure that you're doing this in a manner that's consistent with proper planning and technique so that you can get there, you can show your progress, you can measure your progress, and you can figure out what's working and what's not working. The CAP survey is a huge component. Although it's only 2 measures, like I said, it's an agency-wide effort. Your timely submission of Oasis data to your CAPS vendor is very important. You want to make sure that you're doing this either weekly or monthly, depending on however you've arranged the schedule. You want to make sure that your CAPS vendor is easily accessible. You can transmit information easily. You can view the information that it's been received, that it's been downloaded by the CAPS vendor, and it's been sorted and worked. You also want to make sure that the reports are easily available. If you're not downloading reports from your CAPS vendor or getting reports from your CAPS vendor, you need to start that soon. You need to really see what's going on. If you're an agency that has been submitting Oasis data and your data doesn't look quite like your agency in general, for instance, if you do internal review surveys, if you send those to patients and you ask how well you did, or if you do full follow-up phone calls after discharge to see how well your staff treated the patient and how happy the patient was under your care. If you're getting higher ratings on those, but you're getting lower ratings on your CAPS surveys, something's not jiving. You want to find out why. And that's all going to start with getting your reports from your CAPS surveyor. You also want to follow up with your CAPS surveyor and watch them and monitor them and manage them to the extent that they're doing your surveys in a timely manner. The faster you can get your surveys out and get that data collected after a patient gets discharged, the more likely you are to receive a response. If your data is going out much later after a discharge, 1 or 2 months versus weeks, the likelihood of a response is much lower. You want to get it while you're still fresh in their minds, whether that's good or bad. And part of that is through patient education. With so much fraud going on, patients may be starting to get very wary about providing any information about their healthcare to someone who's calling. So when you discharge a patient, you may want to leave the name and the potential phone number of that CAP surveyor so that if they call, instead of issuing a survey through the mail, they know who it is. And even if they are just issuing surveys through the mail to patients, you want to make sure that the patient has that name anyway so they don't think it's junk mail or they think it's some type of scam just trying to get their Social Security number or their Medicare number. Once you get those surveys back, once they get processed and the data gets reviewed and input into the CAPS database at the vendor level, the reports are generated. You've got to review those reports, you need to analyze them, and you need to figure out where you can improve. It could be simple. It could be changing the way you answer the phone. It could be the way the phone calls are directed. It could be how your staff handle the phone calls. Remember, this is all about customer service too. So while you might provide excellent patient care and the wound heals within 2 weeks and the patient's back up and going about their favorite activities, if their experience wasn't that great with your agency from admission to discharge, that's going to stick in their mind, maybe more so than the care. So it's all about patient experience. You want to make sure that your patients are happy, that you sometimes go above and beyond when needed, which most agencies do, but you want to make sure that that's all still fresh in their mind, and getting these surveys out to them as soon as possible is really going to help. So we've been talking about this throughout the call, and it's the effect on your agency, star ratings. If your agency has higher ratings, then you're already in a good spot. You just have to continue to do what you do to maintain that rating. You want to use that to your advantage for marketing. If your agency has a website, you want to put a link or a PDF copy of your star rating report directly on the website so someone can see it. You want to put it on your Facebook page. You want to put it on Twitter, Instagram. You make sure you want to really get it out there so people can know and see and understand that your agency is a high-quality agency and you're doing the best that you can, and it shows. But if you're an agency that doesn't have that higher rating yet, you may not want to put that out there so much. And if someone asks, you want to be able to prepare an answer that's cohesive and coherent to justify why it's not as high. You know, if you're in an urban center and you have patients that may not necessarily have access to care as much and you end up taking care of them for long periods of time, that could weigh down your overall rating. You know, you just need to be able to explain your environment, explain why it isn't as good as you think it is, even though you are providing that quality care. For agencies with a website, of course, you can link, you want to make sure, but you also want to do offline marketing, not just with websites and social media, but put that star rating out there. If it's good, 4 and above, you want to make sure that you get it out there with press releases. You want to get it out to the local media, the newspapers. If you have a local magazine that publishes, you want to have a feature in there. Usually they're open to that type of situation, and they do come at you pretty strong, and they will publicize you pretty well. You also want to look at, local radio stations, a lot of talk radio for smaller areas. That's an effective, free way of marketing, not only for your agency, but also to get out the fact that you do have a high star rating. So your star ratings can open a lot of doors if they're good. However, if your star ratings aren't as good, it can close a lot of doors. This is why the agency as a whole needs to be focused and committed to quality. When you compare your agency against others, it's very important that you understand that other agency. So do some market research. Most agencies know who their competitors are. Most agencies know their competitors' strengths and weaknesses. And when you're dealing with referral sources who look at that information, don't be blindsided by the fact that they're going to have already potentially looked at your star rating and the competitor's star rating. And when you meet with that referral sources to develop that relationship or to expand that relationship, they want to know why your agency is better than the others that are the 4 or 5 star ratings, or why they should refer to you if you're less than a 4 or 5 star rated agency. You have to have a game plan, and you have to be able to show quantifiable results. And that's why having that internal structure in place to educate staff, to set measurable goals, and to reach those goals is all important. There are some upcoming changes on the star ratings, and these are going to be very important for agencies to understand. 2 measure changes are going to be made. The first is the drug education is going to be removed, and a new measure is going to be added to the calculation if they go into effect, and it's going to be the improvement in the management of oral medications. Well, CMS hasn't officially recognized these changes yet. We will see these potentially go into effect in April 2019. So in about 6-7 months, you should start to see these take effect. This is why when we talked about earlier, you have to focus on the Oasis as a whole when doing quality reporting and quality documentation, because you never know when Medicare is going to change the game on you. What the rules are today may not be the rules of tomorrow. It's always important to be ready. It's always important to be active. It's always better to be planning and to have that quality process in place. Eric?
Thank you, Lance. That was an awesome presentation. Really appreciate that. If you have a question for Lance, please type it on the question box to the right-hand side of your screen. While we wait for questions, we have a couple of housekeeping items. If you missed any portion of this webinar, you can see the recorded webinar on shieldhealthcare.com/community. We have all these great articles and blogs on lifestyles, on helpful videos, caregiver support, and all of our other recorded webinars, and then relevant healthcare news. We also have other blogs on how to increase your star ratings and Oasis scores as well. Next slide, please. So also on shieldhealthcare.com, you can access these guides online. We have things like Living Well with an Ostomy, Tube Feeding Guide, Wound Management Guide, Living Well with Incontinence, and we just launched our Aging Well at Home Strategies for Living Well at Home booklet. You can go on to shieldhealthcare.com and type in your relevant information, and we'll send you a copy. Next slide, please. And be sure to like us on Facebook, YouTube, Instagram, and Twitter. Again, all of our webinars are recorded and stored on YouTube and our Facebook page. And we have, again, relevant articles on ostomy, incontinence, living well at home, caregiver support, things of that nature. So please check that out. So we got a few questions for Lance. Again, if you have a question, please type it on the chat box to the right-hand side of your screen. Lance, a question here from Ellen. Traditional Medicare patient data contributes to the star rating. Does data from patients with Medicare Advantage plans also get counted into the ratings?
No, that's a very good question, but unfortunately it doesn't. So if your agency's population is heavily Medicare Advantage versus Medicare, those Medicare Advantage plans and that data is not going to factor into your rating. It's only traditional Medicare.
Great, thank you. Will our CAPS vendor be able to give us information on patient responses and how those responses were received?
Yes, that is a very good question, and that's a very good component of having a CAPS vendor that's ready to meet the challenges. A good CAPS vendor should be able to provide a report that shows the total amount of surveys that were conducted, whether it's orally by phone or through mail, and the response rate. If you see that you're not getting a high response rate and you have a higher census agency, you may want to speak to your cabs vendor and find out what's going on, or look at another vendor, because you should see a pretty good response rate. It's not the best response rate, but it is better than most direct mail.
Great. So I guess we have a few questions about the slides for today. Again, this is being recorded, so you can access the slides, and it's available on PDF on the handouts. So if you see on the right-hand side of your screen, there's a drop-down that says handouts. There's a PDF version of the slides for you to access. Okay. Question here from Kimberly. Because CMS is so late in reporting updates to star ratings, do you know of any agencies or organizations that are taking any legal steps to force CMS to report updates in star ratings in a more timely manner?
Not that we're aware of. That might be something you want to discuss with your state advocacy organization, your state home health organization, or even the National Association for Home Care. They are in touch with CMS, and they would probably have some good feedback for you on that, and would be the best groups to contact to help see if that could be done.
Great. Thanks, Lance. Do referral sources such as hospitals and other providers have access to more detailed information?
No. Hospitals, referral sources, they have the same information that you see on your preview reports from Casper, and they also have the same information that you see on Home Health Compare. If a referral source wanted to get more information, they might be able to do a Freedom of Information request from CMS, but I'm not sure they would actually gain any more information than what you already have.
Great. Thanks, Lance. I think we have time for one more question. If our star rating isn't great yet and someone asks us why, how much should I tell them? What is too much transparency?
That's actually a really good question. And that is something that you want to develop not in a 5-minute thought, but over a few-week process. You want to really sit down and look at your agency's strengths and weaknesses and be honest, but you don't want to mislead. So, if you're in an area where a lot of your patients have a common diagnosis or they have common issues, and you treat your patients maybe for longer periods of time, which can weigh down your star rating, you want to be able to explain that. You want to be able to have data that shows that. You also want to make sure that you're showing that you are an active member of the community. There's a lot that goes into that goes beyond just the data that's reported. You want to show a lot of non-data characteristics. Do you have a lot of staff members that have been with you for a long time? Is your turnover low? The quality of nursing. Do you have a higher ratio of RNs and LPNs? Do you use a lot more PTs and PTAs? Do you have your own staff as opposed to contract staff? Really go through your agency and list the strengths and weaknesses, and then pull out those strengths that really make your agency what it is, but also show that you do have some weaknesses, but you are working to address them.
Great, thank you. What will be the impact of the forthcoming Oasis D in the star rating?
Well, as we saw in April of 2019, CMS at any point can decide which measures they want to add or remove from the calculations. So as the Oasis D gets more developed in the coming years, we may see a continuous shift from some measures being added and some being removed. We may see some measures removed and then added back again. It's all about what CMS basically feels like at the moment, or what they feel is if the data points get too high for that measure, like the flu vaccine, where most agencies reach 90% or better in reporting, then that really isn't a measure that they can use.
Awesome. Thanks, Lance. Where can we get the star rating in the Casper report?
If you log into your Casper system and you go into the inbox folders, once you're in there, look around. Depending on how your agency is set up, there's a couple different inbox folders. There's a regular inbox, and then I think it's called a virtual inbox. Check there. CMS automatically places those reports in there. They'll open up as a basic text file that you can either print or you can save as a PDF on your computer. and then analyze the information. They will stay in there for quite a while.
If we don't send in our Oasis data on time, is there anything we can do that doesn't affect our star rating?
That's a tough one. If you aren't sending your Oasis data in on time, you may want to look at your internal processes, because timely Oasis submission is very important. You really should focus on getting that information updated and uploaded timely before you do anything else, and then from there work towards improving your rating.
Awesome. Thanks, Lance. I think that's all the time for questions we have. I'd like to thank Lance Tortolano for that great presentation. Stay tuned for our upcoming webinar, October 24th, Common Urinary Catheter Complications and How to Address Them. So again, to get your CE credits, there's a handout on the right-hand side of your screen, and look for an email from Capital Nursing Education. And if you don't receive it within 5 to 7 business days, please check your spam folder. So again, look for an email, Capital Nursing Education, or you can look at the handout on the right-hand side of your screen. So I'd like to thank everybody for attending this webinar, and again, thank you to Lance Tortolano for that great presentation. Thank you, everybody.